Over the last 24 hours, we have identified 1,081 new cases of COVID-19 and completed about 12,000 tests. Our positivity rate currently stands at 8.9%. We have identified 705 additional cases of variants of concern in the last 24 hours. Variants currently represent about 52% of our active cases. There are now active alerts or outbreaks in 453 schools, which represents 19% of all schools in the province. A total of 2,653 cases have been linked to these schools since January 11th. We are seeing a sharp rise in cases in school-aged Albertans as well as those in all other age groups. While there are no risk-free options with COVID-19, the rise we have seen is not attributed to any single cause, and in fact is often linked to social gatherings outside school rather than transmission within classrooms. This reinforces the importance of following the measures in place, not only during school hours, but before and after them as well. There are now 402 people in hospital being treated for COVID-19, including 88 in the ICU. Hospitalizations are increasing province-wide, and cases continue to rise sharply. My team is monitoring closely, and if we do not see growth slowing soon, further measures may be required. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones of these individuals who are mourning their loss, and to anyone who is grieving a loss at this time. I am pleased to report that we have now administered more than 900,000 doses of the vaccine in Alberta. I want to encourage anyone who is eligible, all 1.7 million Albertans, to book your appointment as soon as possible. There may be some questions about who can book appointments right now, so I want to be clear that anyone 16 or older who has a medical condition like diabetes, COPD, severe asthma, heart disease, or any other conditions on the list available at alberta.ca is now eligible. In addition, this week we have opened eligibility for all those who work in healthcare settings as part of the in-person care teams providing care in community clinics, acute care settings, and other healthcare locations. We've been looking very closely at the experiences of other countries around the world who have rolled out their immunization programs more rapidly. And I think it's critical to remember that COVID-19 is a significant threat to individuals, again, the most significant threat to those who are older, who have health conditions. It can, of course, cause severe outcomes for those who are young and healthy, but the risk is much lower. And so what we're looking at for the summer is we're looking at the ability of the vaccine, once we're able to offer it to all Albertans and start rolling out our second doses as quickly as possible, that we believe we will have the ability to, while we may continue to see some infections, that the impact on our acute care system can be significantly mitigated with what we anticipate will be our vaccine rollout at that time. There are 2 important things to consider when we think about that. One is that that strategy will work if we are able to reduce the volume of infections right now, because as I mentioned, our vaccination program can build a wall of protection that's effective, particularly after the second dose, but if the flood of new infections is greater than our ability to contain it, that could delay that opening strategy. And the second thing that's really important to remember is, again, that we need to make sure we're considering both the protection of the first dose as well as the second, and take that into account as we're planning forward. We regularly discuss the current state of COVID-19 in the province with the COVID Cabinet Committee and regularly give presentations on where we're seeing spread, what the trajectory is. We have seen an increase in all parts of this province, and in fact if you look at the different health zones of the province, every single health zone has experienced a significant increase in the past while. So the question about how soon could we see measures or how soon would we have those discussions, it really depends on what cases we're seeing and the trends that we're seeing. So as I mentioned, potentially, again, no decisions are made. Whether or not there could be something within the next week really depends on the situation and how quickly things accelerate. But I think, again, the reason that it's difficult to be able to give a precise timeline, I understand people want predictability. They want to be able to plan. But unfortunately, again, COVID-19, we can control it by the means that we have put in place, but we need Albertans' help to do that, which leads me to that next question about selling it to those who feel that the current restrictions are already too much. And I think, quite honestly, what's important is, again, to remember the impact that COVID-19 had on our hospital system in December, and the potential, given that the variants of concern are even more infectious, and in the case of B117 appear to be even more severe, that our hospital system could have an even larger impact than we saw in the winter unless we intervene. And ultimately, I understand that Albertans are tired of this. They want their lives back. They don't want restrictions. That's, I think, true of all of us, that we would prefer to not have restrictions in place. But the reality is that until vaccines are in the majority of Albertans' arms, all that we have to protect our health system is these public health measures. And that's the truth that we will share with Albertans, that we continue to share with Albertans, is that we depend on each other to take these measures so that we continue to have the capacity to care for people with heart attacks, strokes, car crashes, and other things that happen every day. And we need to keep health system capacity open for that by limiting the spread of COVID-19.